During the pandemic, opioid overdose deaths skyrocketed in the U.S. to an all-time high.
There is some hope. Proven medication to treat addiction is now more accessible to those who need it. News specialist Heather Simonson spoke with a Utah doctor who says it's highly effective treatment.
Buprenorphine has been prescribed since the 1970s.
Helps with withdrawal, helps with cravings, helps people with their recovery.
But not widely used by doctors because of the difficulties involved in prescribing it. That's according to Dr. Paula Cook, an addiction specialist.
Previously, we've required a training and a waiver for providers to be able to prescribe this medication.
Buprenorphine is a partial opioid and a controlled substance. And while prescribing it always carries risks like sedation, overdose, and abuse potential, Cook says it's much safer than all other opioids. She says the benefits of getting it to more patients who need it far outweigh the risks. Buprenorphine stabilizes the brain, allowing patients to focus on recovery, giving them a greater chance at sobriety, according to Cook.
More people are able to get away from opioid use and get back to living opioid-free lives.
And there's good data to back that up. According to the National Institute on Drug Abuse, people taking the drug are less likely to die from overdose or to transmit HIV. They're also less likely to commit a crime.
If you ask patients who are on buprenorphine, they'll tell you it's a game changer. This just makes it more accessible. It means that more providers can step up.
The drug can now be prescribed in outpatient clinics, reaching rural areas and also people unwilling to go to rehab.
Allows more providers to come to the table and think of this medication as a first-line response to a medically diagnosable condition.
An effective tool in the arsenal against addiction, now more readily available. Heather Simonson, KSL 5 News.